Need a doctor? Let HCA Virginia help. Click here for our physician locator or call 320-DOCS. Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch is diagnosing your knee pain and options for treatment. The severity of knee pain may vary depending on what caused the problem, but some of the symptoms include swelling and stiffness, redness and warm to the touch, weakness, popping or crunching noises, and difficulty straightening out the knee. Dr. Goradia, I've said that right so many times earlier, is here from Chippenham Hospital, and he's here to give us some medical advice. Talk, if you can, Dr. Goradia, about some of the symptoms and what it means if you have swelling or you hear the crunching sound and that type of thing.
So swelling and crunching and kind of an aching, deep pain in the knee could be a sign of arthritis, whereas if you have an injury where your knee might pop out of place or something, that could be a sign of a ligament injury like a torn ACL.
And talk about some of the available treatment options. We were chatting earlier about the Mako Robot. How is that used? And I would imagine that's in severe cases.
Yes, the Mako Robot is something that we use to help us do partial knee replacements, and it's actually a robotic arm where we plug in all of the patient's data into the computer and allows us to get very reproducible results.
What are some of the factors that increase a person's risk of having knee pain?
Well, certainly knee injuries, so sports participation, sometimes heavy laboring types of work can also cause people to have injuries to the knee that can set them up later for arthritis and other problems.
And how do you prepare for an appointment? I'm sure there are things that you probably need to monitor and keep track of so you can be sure to talk with your doctor about. How would a person prepare for that appointment?
So patients should be fully able to describe their symptoms, what they're able to do and what they're not able to do, and make sure that the doctor listens to those as well as what their goals are so that we can get them back to their previous level of activity.
All right. And what's your best advice for someone who is experiencing knee pain? When should they know to contact a doctor?
Sure. So, some swelling, some aches and pains, and you take some medications over the counter and ice it. If that's not helping you, you're getting a lot of swelling in the knee or it's giving way or catching, then you should probably talk to a doctor.
All right. Dr. Goradia from Chippenham Hospital, thank you so much for coming. We appreciate it.
Absolutely.